I have people in my own family who really struggle with headaches. I used to, for a long time, struggle with them myself. And so the idea that CBD might be able to play a role in health management for this topic is pretty significant. Why don't we start by talking about the difference between headaches and migraines? For a lot of people, if you've never
Yeah.
experienced the former, you just think that's all the latter. Give us a sense as to medically how we distinguish between the two, or do we
Yes.
distinguish between the two?
Yeah, migraines fall in the category of headaches, right? So there are a bunch of different types of headaches you can have. You can have tension headaches, cluster headaches, sinus headaches. You can just have common headaches. You had headaches, secondary to brain injuries, concussions, dehydration, certain numbers. So it's one of the categories. But there are specific things to migraines, right? So migraines typically have like an aura or something, well, something that kind of like tells you it's about to come on. So it may be a visual disturbance, like, hey, I'm starting to see spots, floaters, my visual changes. It may be a smell. Sometimes people smell things and they're like, hey, I know a migraine is coming on. And it's, sometimes associated with other things. So for me, it was photosensitivity, which means light sensitivity, right? So bright lights would like, drive me off the deep end. But sometimes it sounds or it smells, right? And then, usually it'll locate to one side of the head. It can move around, so not everyone has like the same presentation, but those are kind of the general things that these are migraines. And the other thing about migraines is that they're really hard to treat. So your typical headache kind of treatments that you would do, like, oh, I got a headache, I'm going to take, something really, so Tylenol, something for my headache. Migraines tend to not respond to that, right? So they can go a little further, and what happens is that you get this kind of debilitating head pain. And so that kind of head pain causes a lot of disruption in people's lives, work, decreased performance, missed days from work, mental illness, depression, anxiety. So, it's something that bothers a large percent of the population. And there are a number of things that people try all types of things for migraines, right?
Right.
Uh,
I've seen
so
the head caps you can put on that
yeah,
squeeze the head and like apply the pressure. There's a lot of, it feels like every other time when you're having a migraine, it feels like all around people are giving you ways to manage a migraine, but
yeah,
not
yeah.
often do they
So
work.
that's the interesting thing about, right? So we know what this thing is, and we're like, yeah, it's a type of pain, a head pain, and it's like, well, this is what we would do for head pain traditionally. And then when it comes to this, it's like, well, all that stuff sometimes is not enough, right? So it makes this a kind of nebulous condition where you're trying to find these solutions. This thing exists, and then the typical treatments sometimes they work for a little bit, and then it stops working, and then you're back to you're back to stage one again, suffering from
Right.
these, people can't drive. I had patients who like it disrupted their ability to work because they couldn't drive with, to get to work with these migraines. So definitely it's something that's close to my heart because I was
Yeah.
suffering from migraines from football, from concussions, blasting my head into to people, pause, so that years later, I'm like, my head is on fire. And, bright lights used to throw me off kilter. Like I couldn't take it. To the point where I used to wear sunglasses a lot. So it's like, son, you try to
Wow.
look cool. Like, what's up with this dude right there? Like, we're inside the library. What's up with the sunglasses? I'm like, I cannot take these fluorescent lights. Like, they're killing me. If I
Wow.
don't put these glasses on, these lights are going to make my head explode. So,
Hmm.
yeah, man. So for me, it's another thing that's near and dear to me.
Yeah. So, seeing as you've taken down this parade of horribles, and actually briefly, I remember when I first began realizing that there are different types of headaches. I used to get these headaches, and sometimes still do, where they start actually in my shoulder at the base of my
Mhm.
neck, and it's like an electric zap, and it goes like right over the ear. I don't know what it is. I've talked to my doctor about it, but it's so infrequent. I didn't know, but it would come and it would be persistent, and then it would just go away. And it was like, is that a flash? Is that a lightning headache? I don't know. And then I began realizing there are a variety of different types of
Correct.
headaches, and we can experience them in a variety of ways. But because this is the topic of Flower to the People, I am presuming you're gonna have some information for us about who tends to get these headaches,
Of
and
course, of
please
course.
tell me you have a
Good
solution
news.
that perhaps people have not explored up until now.
All right. So, of course, we talk about who gets it, right? Now, interesting thing, this is the one condition that we usually say, we get it worse. So actually, Caucasians get this worse than we're second. We're this is right. So we finally caught a break, right?
It
Now,
doesn't always work in our favor, but we'll
right?
take it. We'll
It
take it.
always right, but we're number two. So it's not like we got a big break. But the bad side of that, of course, is that when we do get the diagnosis, we tend to get uh, lower or less effective treatments or seek treatment. So we tend to manage it less effectively. So whereas, Caucasian white Americans get it at higher rates, and we're second to that, the persistence or the morbidity of it is worse in us. And again, for the same kind of reasons, lack of access to adequate care, some of the disparities in terms of managing pain. For example, we know that Black women, the pain when you go present to an emergency room or doctor and you discuss your pain, it's usually not appreciated at the level for what it should be. So migraines are no different from that. So that's a phenomenon. So unfortunately, I do got to sprinkle in some of the systemic stuff that exists still goes into this. The other thing that happens, and it tends to happen in younger people. So somewhere around your teenage years to your middle age years is the peak of that. So it's usually, and amongst sexes, it's usually women. So sisters, I love you. Y'all be going through it. So it is usually women suffer from it the most. And again, African and American women have the highest rates of poorly managed or poorly treated migraine. So I love y'all. That's why I'm here. I'm here because I love y'all. I want to give you some options to get it treated and taken care of. Now,
We
yeah.
appreciate that because Lord knows it's unjust. It's unjust in a whole host of areas. I feel like I need to speak to a manager about this distribution of pain. Get the manager on the line. I'm going to tap into my own parents.
So, um, so the other thing too, we also have to mention, we always talk about this stuff is socioeconomic status, right? So people of lower socioeconomic status tend to suffer, and there's a number of reasons for that. And as we become more in tune with some of the disparity, the causes and the ramifications of health disparity, for example, stress, overall life stress, right? So you ain't making a lot of money, times is hard, things are tight, right? That's gonna, give you a predilection for having spells or attacks of migraines, poor food quality, poor air quality, poor sleep quality. These are all things that are more prevalent in people who are lower socioeconomic status. And unfortunately, that's us, right? So predominantly in the US. So we do, we still get the business a little bit, but we're gonna make it. We are gonna make it, right? I got
Yeah.
y'all, right? So, so like I mentioned, traditionally back in the day, so when I was getting headaches, I would get the headaches from playing football, right? So I didn't know at the time that these headaches were because I was damaging my brain. It was just like, this is what happens when you play football. So I used to go in my
And
mom's
wait,
nest.
nobody on your team, nobody in the coaching staff was like, you guys might get headaches because you're hitting your head into
Nah,
something.
it was like
That
you got
wasn't
to
a
suck it up. That's like part, and you got to play through that, right? So you got to
wow.
figure out a way to play through that. When I was playing, it was like, yeah, we know your head hurts. Everybody's head is hurting, right? So
Wow.
as a kid, I would raid my mom's medicine cabinet and I would take Midol. She had it, right, which I didn't know was like for menstrual cramps.
Well, that makes sense. I don't know if that was for you, sir.
Yeah,
But
yeah, so this is
I mean,
like
you can get headaches when you get cramps. So I mean,
yeah, right. But I needed something to take the pain away. So I was taking her, I would take her Midol. I would take her Dones. She had this other thing called, I remember this in the you ever,
not you in the reproductive health support to
no,
help your
no,
headache.
my headaches, right? And then, of course, the Tylenols and aspirins. And so those all fall into the category of what we know as NSAIDs, non-steroidal
Yeah.
anti-inflammatory drug. Very common stuff, ibuprofen, like Advil and things like that. The bad thing about those is long-term use of that is bad for your stomach lining and it's bad for your kidneys.
Yeah.
And it thins your blood out. So if you've got some sort of bleeding or clotting disorder, it's not something that you want to do, right? And they're less effective. And so people would go through, and this is like I did, you go through the stages of this stuff. All right, I'm gonna get the first thing, like my head is killing me, right? I can't take it. Like my head is pounding, you'd be like, people, yo, you want to go chill? I can't today, son. Yo, I got a headache. It's killing me. And then when you usually go to the doctor is when the stuff that you've been trying at home ain't working. So you go to the doctor and they'll prescribe you usually like now more common is the triptans, like sumatriptan, and I know a lot of people who probably listen are on there. And then you can sometimes get SSRIs, which are antidepressants. So this, we'll give you those things as well, off label as pain relievers for
Oh, wow.
migraines. Yeah. Now, some of the things that happen is that they cause you to have circulatory issues and they can also cause heart issues, right? They'll cause palpitations. So people who have heart conditions don't deal with those well. And so it's like, all right, I would like to get some relief, but when I take this, it's like I give myself another, right? And then you have ergotamines, which are another category, and again, have side effects, right? And so people will take those, and those have some effect, but they make people sometimes like violently ill, like nauseous. They can't hold nothing down. They feel sick and queasy. So you go from having a headache to a stomach ache, right? So you're like, I'm trying to get my headache taken care of, but damn, I can't hold nothing down. Then so what has happened over the years is, and this is the good thing I think about listening to patients, is that they're looking for their own stuff. And as a result of doing that, we found out that some of the things that people have been talking about actually work. And so one of the examples of that is acupuncture. Actually, there are studies that show that acupuncture works. There are like a bunch of studies for that. Acupuncture actually is effective in many chronic pain conditions, right? It's part of like the all of the above. If you're a chronic pain sufferer, it's one of the, hey, everything counts, right? So there's things like
Yeah.
acupuncture. Dietary changes are a big deal. So we know that diet affects us in a whole lot of ways, but we don't pay a lot of attention to it. So
Well,
migraine,
because
I know,
usually the diet, we like the taste of it, even if it's causing us harm, and we don't talk about it because we don't want to. I like
yeah,
the
right. But
things that
some
I'm
of
eating
us
and
too, we ain't got no choice too because of the
because
lifestyle
of
that we
that,
live and
or the
in where we
community that
live.
we live in.
Yeah, and
Yeah.
where we live, right? So there's like a thing they call the 5 C's of like you should avoid. It's like caffeine, Coke, foods, chocolate, and there's one more. Yeah, you're like
Chocolate right there. Now,
cheese.
yeah, I was with you, but chocolate.
Cheese, right? And so what happens is that when you're consuming these things in there, they tend to,
Wait, you said cheese?
yeah, cheese.
Oh, snap. You just help. Oh, hold on. That might, because I told you there's people in my family who are dealing with headache, and we are some cheese.
Cheese,
Oh,
y'all bad cheese,
snap.
y'all be cheesing. Yeah. So it's known as the 5 C's of migraines, like the five things that you should avoid,
Wow.
right? So cheese, caffeine, citrus fruits, chocolate, and what was the other one? And Coke, right? And all of
Wow.
that, you say a
Okay.
couple of them will
And you
have.
mean Coca-Cola, not
Yeah,
cocaine.
you should avoid that too. As a
Also,
doctor, as a doctor, I
oh,
would say avoid the cocaine too. All forms. Stay off the crack, kids.
it's gonna make your headaches really bad.
Really bad.
I was like, we should not be laughing about that, but I did need
Right?
a mental spirit cleanser. I told the team, I was like, we're talking about gun violence today, but Dr. Damas gonna be on to close us out. So we gonna start heavy, but we gonna end on an upbeat note.
We're gonna end on y'all got to look out for my people.
That's
On a
right. That's
side
right.
note, I'm not gonna bring us back down, but I am a little saddened by the fact that we'll move on. So it's happened so much. We move on so quickly from this. It's just like, Yeah, life go that, yeah, that happened yesterday, and all right, we're just like on to the next thing, that we've just kind of gotten to a point where we've accepted it, which is really like so on to the lighter stuff. So,
Yes.
and then the last thing is like these kind of like self-care. So it's biofeedback, which is kind of like you understanding or being in touch with yourself. And like you were talking about these kind of like tension-induced headaches that you get. So
Hmm.
things like your stressors, clenching your muscles, muscle tension, muscle pain, and those kind of things actually, like, right? It sounded like back in the day, it'd be some kumbaya kind of thing. Like, well, you know why you gonna, you know what you should do for your headaches? You should just try to relax. Yep. And it's true. You should try to relax. You know what you should let your shoulders down and take a couple of deep breaths, like all that stuff. We'll be like, yo, what kind of hocus pocus, you know what I'm saying? Tree
Meanwhile,
hugging,
we be all hunched up, back
hunched
over,
up,
crimped up.
fled.
Your
Yeah,
inner
right.
body chi can't flow. Your
Yeah, right.
meridians are clogged.
Grinding your teeth, doing all that stuff. And that actually works. So there's studies that show that that work. And so I say all this stuff is sometimes where you're looking for a solution, you think that the solution is going to be one thing. And it actually, the solution, and this is a complex condition, the solution that people that I've treated and myself personally, the best thing that is like all of the above, right? Like the cheese, the dairy, the caffeine, I stay away from it. I exercise, I meditate, I avoid the bright lights. So I do wear I know that that's a triggerer for me. Lack of sleep. Alcohol is another big one, right? Alcohol is literally, yeah. So alcohol is another trigger. Yeah, you got to chill, stay off the sauce, two things, right?
No
Put
cocaine, no
no
crack,
cooking. Yeah,
no caffeine, no
yeah.
chocolate.
No, no, I'm a killjoy, right? Yeah. All I want you to do is breathe.
Just actually, you know what though? Just for the record, for people out there who are perhaps new to the show, we're joking right now. This is our joking voice, so we're not like, I mean, but yes, you should also not do those things. But we're not just some people out there that listening comprehension ain't necessarily not for
Yeah,
everyone.
right. It'd be right.
When they
Yeah,
share it
so
with their friends, they Lord.
exactly. Hey, Damas said crack. I heard him say crack.
He said, I said inhale. He said,
Yeah,
so what?
exactly.
So is there when you're doing all those holistic things, you're minding your foods and you I don't want to rush us, but I'm mindful
Yeah,
of the time. I got the voice in my ear, the Wizard of Oz in my ear, so we got to move on.
listen, yeah,
Is there a role for CBD for that can
absolutely.
add to those things to help us manage what it is? Because it's debilitating. The pain is just
Yeah.
absolutely awful.
Right. So here's a couple of things, right? You want to look at it at decreasing the frequency of attacks. And when you do have those episodes, decreasing the intensity of those. So two very important things, how often you get them and how intense they are when you get them, right? I barely get them anymore. Again, I pretty much take CBD daily. So it just keeps everything kind of chill. And I avoid my diet, avoid eating things that would trigger that. And so the CBD, there have been a bunch of studies actually that have shown against placebo and against other medications that it's sometimes even more effective than the hardcore opioids and other things for this headache pain, and people tolerate it better. And so you have two options. You have the CBD and you have the THC. Both have been shown to be helpful, but of course, THC is going to get you high. So it may not be best for you if you got to work all day, you got things to do. And it's like, well, I want to keep my migraines down, or I want to keep it at a level that it's not debilitating. Is
Right.
there something else, right? And I don't want to take the ergotamine because it makes me nauseous, right? I don't want to take the triptans because my heart is beating fast when I do that, right? And so here you are. Here's this thing. I don't want to take the NSAIDs because it's messing up my kidney. So here's this option that doesn't have all of those. That's a very good safety profile. It decreases the pain level, the pain threshold. Studies have shown somewhere between 20 and 40%, right? As opposed
Wow.
to so this is like they've done the studies. This is not, whenever I come and talk about this stuff, this is not hocus pocus, right? These studies have
Right.
been done that show this has effectiveness.
Mm.
And so people sometimes don't know that this is an option for them. So they come in and like, oh, by the way, I've been having these headaches. Is there something? And they've also shown that topical, so it's not just the stuff that you eat, but you can actually rub the creams and the cannabis
I've done
oil,
that.
CBD. Yeah, there you
I've
go.
your cream actually. I've used your
Yeah,
cream. I've actually used the reliever. That was actually very helpful for neck tension headaches that I was experiencing. But you
yeah,
also have that the hemp cream.
yeah.
It comes in the little contain that
Wait,
that worked. That was
yeah.
decent.
So it's interesting, like these topical things. So I usually tell people it's, take something edible, systemic. I prefer like the tinctures or edibles because they last longer in your body as opposed to smoking. And then something about smoking, there is some evidence that smoking tends to irritate your vascular system. So it can actually, if you're smoking, like if you're smoking out of like like a tobacco leaf, like it's like you're actually doing something more harmful, right? Because the tobacco leaves, like the white owls and backwoods and things like that can irritate your blood vessels. So edibles,
And that's true.
tincture,
Is that true for the Fanta leaves too? For people who know, like
like
maybe it's in
grabba.
certain communities. The Fanta leaf. It's like it's not. I've never actually seen it in an official package. It's usually somebody's Ziploc bag, but it's like
Yes.
it's a
It's a,
natural leaf
yeah,
that, if you're on 125th Street or if you're in certain parts of Brooklyn where the vendors are out, they'll have this extra leaf
yeah,
as well. It is that also my concern is combining a leaf from another plant with that plant as an
yeah.
inhalation. That to me feels a little concerning.
Funky. So a lot of people like to do this stuff. The interesting thing is, from my end, because it's only certain communities and certain people do, there's not a lot of research into it. Like there's, right? So for me to say that, but we do know, just to be cautious, is that like I don't like to buy stuff from people. Like, I don't know what you did. You'll say, where did you get that? Right? It just came out of a bag. What was in that bag? So I'm always like a little suspicious. The other people have, they may have established relationships. I like, if I do smoke, which I don't like, hemp leaf, right? It's already part of the plant. So you can get hemp leaf papers and roll up in that. So I think that's the best. But again, I'm not a big smoker. I know some people do like to
Right.
do that. But for the one thing about smoking is that it's the fastest relief method. So if you're like, you get hit with something right there, that's the thing that's going to hit you the fastest.
Okay. So we've got inhalation, the tinctures, the edibles, the topicals, and you have, I don't know if you have the inhalation, but you've
Yeah,
got,
we have
I know I've
pre-rolls.
seen the topical. Okay. And I know I've used the tinctures that you provide.
Mm.
They were actually really, really great for sleep. And I'd never tried one for a headache, but the topicals were super, super, super dope. I really appreciated the relief. It was wonderful. But it feels like if we're, and again, one of the things I always appreciate about you, Dr. Damas, is that you're never just like, I got the little thing in my container and I'm gonna give you this little thing. You always, before we ever get to the
Yeah.
CBD, we're going to talk about the holistic approach, because this isn't just about, we're not trying to replicate the American medical system where you got a
No,
pain, got a pill for it, like take it, here
yeah,
you go. Like, we're not
yes,
trying to do that. We
yeah,
want to have a holistic mind, body, soul, diet sort of approach to these things so that our bodies can experience wellness. And then as needed, we can incorporate CBD, which is one of those elements that's got what feels like the least amount of side effects, and the most upside in terms of potential.
correct.
So that to me, I think is I'd like to highlight that, because I don't want people to miss that. It's very important that we're not just looking to CBD to solve things that might also have a solution in just us managing our diets, managing our
Correct.
stress levels, and doing some of the things that you talked
Just
about.
relaxing your
However,
shoulders. Just relax. And
I just felt my
unclench.
shoulders drop as soon as you said that. I've been like this the whole time.
Yeah,
Y'all are
exactly.
gonna see this on the YouTube video. I've been like this up all day, and then now it's just down. As you said, relax your shoulders. We actually did a moment of gratitude where it was just a relaxation. I was like, relax your eyebrows, relax your eyelashes and your eyelids. And I got some people who were like, I never thought about relaxing my eyebrows before, but they was all crunched up in the middle of my forehead.
Yeah,
So yeah, mindfulness,
yeah.
mindfulness.
Very demure.
Dr. Damas, very mindful, very
See,
cute.
very cute.
Very cute. Dr. Damas, what's the best way for people to, one, call you and talk with you or your amazing team, because you have some amazing customer service reps. But if they are interested in looking at any of the options that you provide on the CBD side of things, what's the best way for them to do that?
The two best ways. Website is quick and fast, drdamas.com, drdamas.com, or you can spell out drdamas.com. And you can call us 833-362-3262, 833-362-3262. You go on the website, you purchase anything, make sure you put some respect on our hostess with the mostest, the soror with more. You'll see. Right? Right.
Better put and spell it
Lurie,
right. It's Lurie.
yeah, Lurie. Say it louder for the folks in the back.